You're listening to The Nocturnist, Black Voices in Healthcare. I'm Ashley McMullen. 3 months ago, on May 25th, 2020, George Floyd, a black man, was killed by police in Minnesota, who kneeled on his neck until he took his very last breath. Today's episode is our last, so we wanted to take this moment to celebrate that even in the midst of so much death, somewhere, life is just beginning. There's unspeakable anxiety that comes with bringing forth Black life into a world that still sees Black lives as expendable, but also universal love, beauty, and sense of hope. This week, you'll hear stories that moved us about the excitement and fears of pregnancy, the mysteries of labor and childbirth, and the indescribable joy of hearing a baby's first cry. Here's episode 9, Birth.
I found out I was pregnant with my first child on the same day I found out George Floyd was murdered by police in Minneapolis. That was just such a strange day because I was so happy and so surprised because I've been trying to get pregnant for a while and didn't expect to get pregnant in the middle of a pandemic. And then I watched the video and it was hard to be happy or hard to reconcile those two realities. I work in the emergency room and I felt scared. The whole beginning few weeks just was surrounded by fear for me. There's so little known about COVID and pregnancy, and the world just seemed like it was falling apart at this moment that my world was just starting. But I really thought I was having a girl. I just knew I was having a girl. So a few weeks later, I got that NIPT, the blood test, and I was on the Long Island Railroad with my husband, and we were coming back from a short beach trip, and I got a call from the nurse. I put her on speakerphone. It was kind of hard to hear because we were on the Long Island Railroad. She tells me all my tests came back normal, no trisomies. And she said, "You know what you're having?" I said, "I'm having a girl." And she said, hold on 1 second. I guess she went to go check because I sounded so sure as if I already knew. And she said, it doesn't look like you're having a girl, you're having a boy. And my heart sank. I felt really disappointed that I wouldn't have this female bond with my child that I have, like with my mother and my sister and my nieces. And I had no brothers. I had an absentee dad. So the only way I really understand family is with women. And growing up, we shared clothes, we cooked together, we walked around naked, really learned to love my body in that way. So when the nurse told me I was having a boy, that's the first thing I thought about actually was, how am I going to have a naked house with my kid? I feel like I'm just going to lose that idea of what family is, or I guess that idea of what family is has to change. And then we got off the phone with the nurse, and my husband was just like, "How do you feel?" He was pretty neutral about it, but I felt kind of scared to be pregnant right now and to be having a boy of color is just, I'm mixed. I identify as a black woman and I'm mixed, and my husband is white. And I suddenly had this thought of, really, I don't know what this kid is going to look like. Will he look black? Will he look Dominican? Is he going to pass for white? Just not knowing how the world will see him and how I mean, really what I was thinking about is how police will see him and how he'll see himself and me, and how he'll identify, because being black is just such an important part of who I am. It's such an important part of who I am, and I can't imagine not sharing that with my child. And I started to cry to my husband, my white husband, who's a really good man, but he just cannot understand. He just can't. It's not his fault, but he can't understand, what it means to be a black woman in America in 2020 in the middle of all of this and be pregnant with a boy. A mystery boy. Will he be safe? And I'm kind of wishing he's one way or another, hoping that he looks black, but that feels like such a strange thing to say, and it feels wrong one way or another to want him to be one thing, because he's already who he is, or he's already who he's gonna be. So yeah, this boy chose me to be his mom, whoever he is.
So I was having a discussion with my father, my pop, and not too sure how we got into this conversation, but he was talking about how when he was born, back in those days, everybody was born in the house. I mean, all of his siblings was born at the house. My family from Haiti, and not everyone had easy access to the hospital or whatever. You would hire a nurse to come to the house to help deliver the baby. Fast forward about 70 years. So now, I'm a physician. When my son was born in the hospital, I had it all planned out. I mean, I had the iPad out, and we were playing like smooth R&B because I really wanted my son to be in peace. Like, I wanted my son to be born in absolute love, like, welcome to this world, like, welcome to life. Like, that's the kind of environment that I wanted him to be in. The funny thing about that particular day is that we came into the hospital, like, dressed up. Like, my wife came into the hospital, like, in a nice dress. I'm in a button-up shirt because it was, like, Valentine's Day. We were, like, out on a date, like a maybe baby moon date kind of thing. And she goes into labor, so we got to go in the hospital. So, first of all, we coming in dressed up. Now we got to get in the hospital clothes. I had the baby pack set up with the music, the iPad. We playing all the nicest, smoothest jams like you could think of, like nice, smooth R&B. I done kicked everybody out the room. Like, if you weren't part of the medical team, get out. Like, that was. I just wanted it to be me, my wife, and someone with some kind of medical capability to be in the room. Didn't even let my moms in there. Didn't let my in-laws in there. Her best friend. Nobody. Just us. So during the birth, it's not really great to like go in there with an internet's mind, because she's getting like tachycardic, and then I know there was some changes in blood pressure and a little emotional roller coaster of having your first child born. I don't even remember cutting the cord, but I do remember just grabbing it. Like, I was holding my son so long. I was just so happy that my wife like felt some kind of way. Like, can I get my son back, please? Like, I just delivered him, and I'm like, keep holding on to him. I give my son back to my wife, and she immediately just got to work, like skin to skin, like breastfeeding. Like, she's like OB. She knew exactly what to do. Like, it was just so natural. And then we take him, we weigh him, and he was just like straight up. Like, I felt like he was like a mirror image. Like, this boy looked exactly like me. And it was just such a beautiful, beautiful birth. On top of that, it was Valentine's Day, so the love was just definitely there. He came into some jubilation, I'm telling you. So fast forward a couple years now. This year has been kind of rough. You know, George Floyd, like, we upset. All the protests going on, and my wife was working on her shift. And during one of her shifts, while all of this was happening, she delivers a family, a black family. And they had this set up like just like we had it. Like, they had the music set up. They were playing some R&B, black man, black woman. They delivered like a beautiful baby boy. And it was like, she said it was like just like how we do it. And she literally cried after that delivery. Like, I'm pretty sure she does this all the time. So she, I guess she lost some composure or something like that. She was just crying because at the time she was just feeling so tired with everything going on, and it was just a beautiful thing to see. It just gave her so much hope to see that love being continued in another family, in another generation, in the same way that we did it. Thank God for that kind of love continuing.
As an OBGYN on labor and delivery, your ability to touch becomes your most valuable tool. We use technology, we use blood work labs, ultrasounds, things like that. But the real art of it comes down to your ability to touch and feel and make a clinical assessment based on that. I think that's very unique in the medical field. I remember when I first started residency, I thought that the cervical exam, specifically the dilation, was the end-all be-all. I would practice and perfect my exam. One finger is 1 centimeter, 2 fingers stacked on top of each other was 2. 2 fingers adjacent was 3. 2 fingers spread just a little bit was 4. Spread a little bit more to where I would feel it in the ligaments of my hand. It's 5 centimeters. Spread a little bit more to where I was feeling it down towards my wrist, 6 centimeters. So on and so forth. What does the cervix feel like? One of our midwives would always ask us, is it ready? And what she meant was, how forgiving is it? How stretchy is it? She taught us that there's a difference between 90% effaced and tight and 80% effaced and pliable. Where is the baby's head sitting? What way is it facing? And I remember I would have to close my eyes as I would check the dilation, the effacement, the sedation. What does the cervix feel like? The feeling that fetal head that is soft with shifting bones and trying to navigate those just right to feel that sagittal suture and then follow it anteriorly, sometimes posteriorly, until you feel the next suture. How many are there? How many bones are coming together here? What shape is this making? What does this fontanelle look like? And then place that into the baby's space, into the pelvis, and come up with the direction that they're facing. I would have to contort my head, my neck. I'd have to turn and flip my head in the same position of the baby's head so that I made sure I understood exactly where all the parts were. That was a tough thing to learn right away. It was tough at the end, honestly, because those perfectly palpable sutures, once that baby had come down into the pelvis and you can get that capit, all you could feel was this knot, and you'd have to reach up even higher into that pelvis to try to find anything that resembled a suture. Those were the tough ones. They'd ask what the contractions feel like. Are they strong? Are they weak? You can tell how frequently they're coming by the external monitor. You can give a pressure measurement with the intrauterine pressure catheter, but they taught us to just leave your hand there after you perform the exam and feel a contraction. Does the head move? Do you feel it coming down against your fingers? That's a good one. The nurses taught us how to palpate contractions from the belly. They taught us to just put the pads of your fingers just a little above the patient's belly button, find the fundus, because that's the contractile portion. And if it feels like the tip of your nose, it could use a little work. But if it feels like your forehead, those are the strong ones. One of my NICU nurses came to every delivery with us. Would give us the eye if it was looking like they needed to take the baby off of the mom's chest, so we needed to cut the cord quickly. And I remember she taught us that if we were ever unsure, we can feel the umbilical cord, which is kinky and curly and gelatinous. And if you palpate the baby's heart rate through the umbilical cord, feel that pulsating between your fingertips, you could get a good idea if it was above 100 or below 100. And that's how we knew if the baby was in a good place or not. And then afterwards, when the uterus was tired, distended, bleeding, you can just feel the bogginess, we say, the atony. It kind of feels like a soaked sponge. But with some time, sometimes some medication, and you feel it start to firm up, it can become almost rock-like. It's so satisfying because then you know it's going to be okay.
Such a beautiful process to help bring a child into this earth. It's one of the most beautiful things that a human can be a part of or witness. Although my experience for my second child's birth wasn't as beautiful as I imagined it to be. You see, I'm an African American physician, and I gave birth in a hospital in which I didn't feel nurtured and I didn't feel loved by the healthcare staff. They thought I was extremely anxious. It was encouraged that I take some anxiety medicine. I was not anxious. Every time I asked for help in the way of where I was in a lot of pain, when I asked for pain medicine, I was looked down upon. On the day of discharge, I had the most scary event ever. My husband brought me my favorite chicken wings as we were getting ready to go, and I couldn't taste them. And at first I thought it was in my mind. Again, they had been telling me that there was something wrong with me, that I'd been anxious the whole time, that I had been hospitalized after giving birth. And then my face started to droop, and I had no control. The left side of my face just gave way, and my speech started to slur. And I was scared for my life. And knowing all the medical things that I know, the first thing I thought of was, I'm having a stroke. Oh my gosh, I'm having a stroke. I asked my husband, who was standing right in front of me, who's a paramedic, if he saw something different, because I definitely felt something different. He said, yeah, your face kind of looks funny on the left side, and he too thought stroke. So I called in the nurses, who, again, begrudgingly came in because, again, they thought I was just this anxious patient. And the nurse kind of looked at me and said, yeah, I see your eye looks a little bit swollen, but I'm not really seeing anything else. The eye looking a little bit swollen is known as ptosis, meaning my eyelid had dropped from lack of nerve innervation, not that my eye was swollen. The attending doctor came in and said that, it's just an allergic reaction. And my brain almost exploded through to the ceiling. I'm a physician. You don't have an allergic reaction on the left side of your face, on one side of your face where you're slurring and you can't taste anything. We continued to go back and forth. I didn't feel comfortable being discharged. I thought I should be worked up some more. You would think that with the medical knowledge and base that I have, that my physician would be more willing to be understanding and concerned about my own concerns about my body, which I know better than anyone. She said it was an allergic reaction. Should just take some Benadryl and go home. If it worsens, I should come back to the emergency department. But they were pretty much done with me. So I went home scared. Fortunately for me, I have resources, and I called my best friend who is a neurologist. And thanks to technology and FaceTime, she said to FaceTime her immediately because she could tell that my voice just didn't sound right. And she had me do a couple of things that you would do to kind of test for your nerves to see whether you're having a stroke or other types of nerve damage. She alleviated my fears that it wasn't a stroke that I was having. Thank the living God. I was actually having what's called Bell's palsy, which is a facial nerve palsy, which happens quite often in pregnancy, after pregnancy, when the body is pretty much very inflamed, and sometimes the nerves get inflamed and don't work as well. So the seventh nerve of my face, which controls 2/3 of your taste and muscle movement and eye blinking and winking, was inflamed and not working well. And there was a solution to that, but that solution would take time. So I need to take some steroids right away, which my best friend helped to prescribe for me, and just take time. It would take probably maybe 6 months or so to get back to normal. I'd have to do facial exercises. And so I called back the physician and let her know what was going on, how I felt. But I truly felt deep down inside that the way that I was treated was because of who I was. It didn't matter that I was a physician. It didn't matter that I was well educated. And instead of being able to really enjoy my baby that first 24 to 72 hours of going home, I was scared for my life. And I feel like the system had failed me. And I feel like the system had failed me because I was an African American female whom nobody was willing to listen to and take seriously.
The story of my birth was always one of my favorite stories to ask my mom to tell me. She was 28 at the time and pregnant for the first time. And around 5 months gestation, she developed preeclampsia and gestational diabetes and had to be admitted to the hospital. Something happened for her to need cervical cerclage. She couldn't really remember. But for like 2 months, she had to lay on a hospital bed in the dark with her head angled to the floor. Unfortunately, despite all of the treatments that they tried, she developed eclampsia and started having seizures, and they had to do a emergency C-section at 27 weeks. After surgery, she continued to bleed. They went back in to try and stop it. They stopped it temporarily. She started bleeding again. She went into DIC, and ultimately they had to do a hysterectomy. And the way she tells it is like she didn't actually meet me until a week or so later when she woke up from a coma. As a kid, I'd stare at her while she told me the story, my mouth agape, that my mother was a literal superhero who had survived this crazy situation, experience, and almost died giving birth to me. I really realized just how close she actually came to dying and how traumatic all of that must have been. And just like how common it is for Black women to die in childbirth.
So when I first moved to Atlanta, Georgia, I was really excited when I heard that one of my medical school classmates, Tracy, had opened up a solo OBGYN practice here in Atlanta. I got pregnant. And so I called Tracy up and said, hey, who are you going to refer me to for my prenatal care? Because, I'm pregnant. And she was like, what? What do you mean, who am I going to refer you to? You're my patient. That pregnancy with my first child was pretty uneventful. Things mostly went fine. Her office was super close to Grady Hospital. So, me being her friend, she let me just come all willy-nilly for my appointments last minute, worked me in. It was great. One day, I woke up in the morning. I was getting ready to go to work, and I really didn't feel my normally very active baby moving. I was probably about 30 weeks pregnant at that point. And so because, there's really no barriers between us talking to each other, I shot Tracy a text message and said, hey, your little fella is being lazy this morning. And so she calls me, and I tell her that, I really don't feel that much movement this morning. And at this point, I'm in my car driving to work. And she said, if you see a McDonald's, pull in a McDonald's and get an orange drink. It's loaded with sugar. And I promise you, it'll wake that little fella right up, which is what she always called the baby. And so I bought a large orange drink and guzzled it all the way to the bottom of the cup. And by this point, I was off the phone and just waiting to see if I could feel anything. And probably about 30 or 40 minutes after I was in my office, Tracy called me back and said, hey, what's my little fella doing? And I said, I think he's still asleep. And she could hear a little bit of worry in my voice at this point. So she said, I tell you what, who's in your office with you? And I said, nobody. So she said, just go ahead and get on the floor and lay on your back. He won't like that. And trust me, he'll start to move. So I did as I was told. I hung up the phone and I just sort of laid on my back. And I laid there for probably 10 minutes, 15, and nothing. I poked my finger in my side, nothing. This was a crazy day because I was scheduled to give a lecture to the residents for primary care grand rounds. And Tracy called me, and at this point, I'm very worried. And she said, what do you want me to do? You want me to come get you? I can meet you at the office. And, this was a Wednesday. Her office was closed on Wednesdays. And I said, no, let me just give my lecture, and, I'll call you after that. And she said, okay. So I give a lecture, and the whole time I have like a slide advancer in one hand, and under my coat in the little slot on the side, I have my finger that I'm just poking repeatedly in the side of my belly, hoping that it's going to make my baby move. And I didn't feel anything. I didn't even take questions. I just said I had to go. And I kind of tore out of there and took the steps out of the auditorium 2 by 2. Just trying to get out of there because I couldn't feel my baby moving for several hours. And I stepped outside and I just felt the sun on my face. And I was just shaking. I was so scared. And before I could even do anything, I felt my phone vibrating in my pocket, and I looked at it, and it was Tracy. And she was like, hey, how you doing? And she could hear my voice that I wasn't good. And she said, look straight ahead. I'm here. And I looked and I saw her car parked in front of Grady Hospital. And I walked over to her car and she said, get in. I already called Harry. We're going to go take a look. And I just leaned over in the front seat and I just cried and cried because I was so scared. And then I felt a hand on my back. And I looked over my shoulder and it was my best friend from medical school, our other classmate, Lisa. She was there too. And Tracy drove over to her office, and when I got there, my husband was standing at the door looking scared too. And my mom was even there. And she unlocked the office and it was dark. And we came inside and all of us kind of crowded into this little room. And, it was just so quiet. You could hear a pin drop. I still remember the sound of the ultrasound machine and the little whirring sound that it started to make as it kind of woke up. And the squirting sound of the jelly on my abdomen. My husband was holding my hand and my best friend was rubbing my head. My mom was rubbing my foot. And Tracy was sitting next to me on a little stool with this ultrasound probe on my abdomen. And she looked at me and said, "Let's take a look." And I remember that probe gliding across my abdomen. And then all of a sudden, the best sound I'd ever heard in my life. I always say that women need women to survive. I'm just forever grateful for Tracy. She was more than my OB. She was like my angel. She was just exactly what I needed in that moment. She would deliver that son, and she would deliver my other son too. She was decisive. She was present. She was my friend.
I was a second-year internal medicine resident, overnight in the cardiac intensive care unit, and also the code leader. I had rounded on all of my patients. I had checked in with my attending, and I was settling into my call room, about to get a nice stretch of sleep. It was a little before 3 o'clock in the morning when my pager went off. Now, I was terrified that I would miss a page, and so I had it set to the loudest possible ring and vibrate. And so it really was an assault on the senses when it went off. I grabbed this seizing pager, slide on my clogs, hoist the code bag onto my back, and take off running. It was paging us to the lobby, which at 3 o'clock in the morning, there are few, if any, visitors. But I get to the lobby and there is no one there. I mean, nobody. It is completely empty. And I remember turning around in circles a few times when I spied a group of doctors and nurses running around a cab outside. I go through the revolving doors, and there are my colleagues, and there is a lot of commotion and activity. And I spot this man, one of the few not in scrubs, middle-aged, leaning against the hood of the cab. And so I approach. "Sir, I'm one of the doctors here. Can you tell me what's going on?" And he turns to me wide-eyed, trying to make sense of the last few minutes as he retells the story to me. He's 2 hours into his shift when a young couple hails his cab. A young guy and a very pregnant woman, and ask him to take them to their hospital where their OB is. The hospital they toured, where they feel comfortable, where their baby is going to be born. He agreed, and they take off across town But as the moans from the back seat grow louder and more frequent, they get turned around and end up at the entrance to the adult hospital, which unfortunately is a block and a half away from the emergency room, and more importantly, a block and a half away from labor and delivery. The couple gets out as the woman is yelling, "The baby's coming, the baby's coming." She lays down on the back seat and gives birth. Now, the security guard in the lobby was unsure what to do, but he knew if he called a code that a bunch of providers would be there within minutes. And that's what he did. So hearing all of this, my panic and alarm rises, and I slide into the front seat of the cab and peer over into the back. There is a young woman, her head up against the window, a floral quilted bag on the floor of the back seat, which I imagined contained an impeccably packed her hospital items. On the other end of the bench seat is a surgical intern who had already clamped the umbilical cord and was getting ready to cut it. And over her shoulder, Dad, who was pale, almost green, and anxiously looking at his wife and the baby. This very new baby who was laying on Mom's chest, very new, and also very quiet. Now, at this point, I had done 1 month of an OBGYN rotation as a medical student. And so what I knew about labor and delivery was equal parts that 1 month of training and medical TV drama. I honestly wasn't sure what needed to happen, but I went with it because what else was I going to do? Has anyone heard that baby cry? The 3 people in the back seat turned to me. No, the baby hasn't cried. Okay, well then, give me that baby, I said. They passed the baby to me, and I didn't know what to do, but I just started rubbing its back and chest. And when still the baby was quiet, I asked for a suction bulb, and I suctioned their tiny little nose and tiny little mouth. Is my baby a boy or a girl? Dad was now standing next to me. I don't know, sir. We'll figure that out just as soon as we can. Okay, he said. Do you know what the time of birth was? I don't, sir, but we will get all of that information as soon as possible. It was clear that he was desperately trying to fill his role in their birth plan, and we had gone wildly off script. I rubbed harder. I suctioned a little more. And then that baby cried. And it was beautiful. It was incredible. Someone found a blanket and we wrapped this now pink, wriggling, crying baby up and placed them back on Mom's chest, just as our OB and pediatric colleagues arrived, and we all sort of gratefully faded into the background as they took over. I eventually made it back up to my call room and thought, what a crazy, beautiful night.
This has been The Nocturnist, Black Voices in Healthcare. I want to thank our core team, executive producer Kimberly Manning, The Nocturnist founder Emily Silverman, podcast producer Adelaide Papazoglou, sound engineer John Oliver, and medical student Rafaela Posner. Thanks also to executive producer Ellie Block, and program manager Rebecca Groves, and communications manager Cora Becker. Our illustrations are by Ashley Floréal, and our theme song is by Janae E. Black Voices in Healthcare is made possible by the California Medical Association, the California Healthcare Foundation, and people like you who have donated through our website and Patreon page. Thank you for supporting our work in storytelling. If you'd like to add your voice to our project, visit our website at thenocturnist.com. We'll be back next week. Until then, remember, Black lives matter, Black health matters, and Black stories matter.